Okay. All right. Well, hello, everyone. My name is Scott Fisher. I'm a psychiatrist, and I work at Siegel Trials Center for Psychedelic Research. So this presentation is on psychedelic medicine and really more about psychedelic-assisted clinical trials, which is kind of my area of expertise and specialty. So I have been a full-time employee at Siegel for about a year now, and worked as an independent contractor for several years before that. I also operated as a psychiatrist at a practice in South Florida for about 8 years. So my story kind of goes that I was, kind of doing typical psychiatric work, a lot of medication management, a little bit of psychotherapy counseling, and just felt like there was some significant, drawbacks to using those currently available treatments. And I discovered kind of psychedelic medicine and the research that was happening. I did specific training in California on psychedelic-assisted therapy and research. And so this was an area I became very passionate about and really now focus my entire career on this research. And so I really love this work and love presenting. I'm going to give a relatively short presentation today about kind of the work we do at Siegel and specifically our psychedelic work. And going to leave a lot of time for questions, and also there aren't a lot of questions. There's lots of areas that I kind of like to expand upon. So definitely, kind of hold your questions during the presentation. Think of any you might have, and then there'll be plenty of time at the end to go through those questions. Okay. So Siegel Trials, we are a leading site network operating in Miami-Dade and Broward counties. There's several areas of medicine we focus on, but a lot of work in the mental health area. There are a few other areas to do. So we're really one of the first private research sites in the world, including the U.S., to start into the psychedelic work. So we're, kind of on the forefront of it, I would say, and really proud of kind of the work that we've done so far. We're the first patient dosed in one of the biggest LSD trials, maybe ever, certainly the biggest LSD trial to treat anxiety of all time. So that was an exciting milestone for us. And, we just have a whole other list of kind of, really great accomplishments here at Siegel Trials. We've been around for 20 plus years and, really proud of kind of the Center for Psychedelic Research that we've built. There's a lot of other areas of mental health research that we do as well. So our Center for Psychedelic Research, as we mentioned, we're one of the first private sites. We have state-of-the-art equipment and really an expertise in terms of our staff and physicians in working with psychedelic medicine in terms of our training and experience. So we're not really totally new kids on the block in that regard. In terms of running through some of these milestones, we do phase 1 through phase 4 FDA registered studies, and including the psychedelic work. We have all the necessary regulatory things that are necessary to do this work, including working with the DEA on the Schedule 1. We have 3 dedicated dosing sessions or rooms that we use specifically for and are designed specifically for psychedelic dosings. And like I mentioned, we have highly trained facilitators or therapists, and also specialized recruiting in terms of finding appropriate participants and subjects for our research studies. These are some pictures of our dosing rooms. They're really designed to not feel like a clinical setting, so that when people have their dosing experience, they're in a comfortable room with a lot of natural light available. We see there's a couch there to lie down on. We have a musical playlist that is running. The music is kind of designed to help for a psychedelic journey and to promote kind of certain aspects of the introspection that we think is very important to occur during the psychedelic dosing. Some of our studies include having 2 highly trained therapists in the room to help support and keep safe the people doing the journeys, and also include some of our studies have a 1-to-1 model, but a lot of them have 2 therapists per participant in the study. We also include the option to use eye masks, which can be really helpful to kind of promote that introspective journey. We do there's sort of a package in psychedelic therapy and treatments that include preparation, where you get to know your therapist ahead of time. There's usually several hours or more of preparation with your therapist, and really trying to develop rapport. You get to talk a lot about what's going to happen, preparing for your dosing, and what's going to happen during the dosing. We also have usually 3 to 6 hours of integration follow-up sessions in the weeks after your dosing session. And one of our studies also includes 2 dosing sessions. Okay, here's a picture of me. You can kind of see in the background there, the eye mask, the headphones, the person kind of lying down very comfy, and just kind of in a setting that feels comfortable. They used to do, many years ago, they did research in psychedelics in like the 60s, and not everyone was fully aware of the importance of the setting. And they would sometimes be done in, very kind of sterile clinical rooms, and that could be really uncomfortable and lead to challenging trips. So we found that this very comfortable setting where we're able to turn the lights down low and just get really comfy really helps kind of promote kind of relaxing, and it seems to decrease the risk of having bad or challenging trips, paranoia, things like that. Yeah, I'll talk more kind of about our psychedelic studies, but just to kind of take a step back for a moment and talk about just kind of psychedelics in general, because this is an area of medicine and research that is a lot different than many areas of medicine and research where, we know there's a human history of thousands of years of, taking, plants or other sorts of ways of taking these compounds or substances that many cultures have engaged in. It's also of note that in terms of just kind of the Western world's exploration of these plants and these medicines and these compounds, that in the 50s and 60s there were up to 40,000 research subjects, and that research got entirely shut down because of kind of more political reasons around 1970, and the research went into a long period of dormancy. And became very stigmatized, but there was a group of kind of researchers and doctors who wanted to revive their exploration for both medical purposes and also, perhaps larger sort of intentional purposes. And so that's sort of a very different aspect of the psychedelic research where, there's so many indigenous groups who've really held, these traditions for so long, and even under really potentially harsh penalties, including death in past times, or incarceration, even in modern times. And so there's a great indebtedness as well to so many different groups of people who believe in the medicinal aspects of these plants and substances. So psychedelics, the term itself, was coined in the 50s. It's sort of a Greek term, psyche being mind, and delic being manifesting or revealing, or soul revealing, soul manifesting. Aldous Huxley was kind of a well-known Western writer who helped kind of propel, society's interest in psychedelics, and he wrote The Doors of Perception, which the musical group The Doors is named after that book, actually. And the quote itself is from a William Blake poem. So there was a little couplet that Osman wrote, who said, "To fathom hell or soar angelic, just take a pinch of psychedelic." And in just those 2 lines, I think a lot is explained in terms of the just incredible range of experience that can happen with a relatively small single dose of a psychedelic. And we think that there could be, a lot of risk that can happen from, being in such a highly altered state, but also the potential for a lot of healing. So it's important that we kind of, I think, treat these, compounds with a lot of, respect, but also, really investigate whether they could be helpful for, in the case of our studies, helping people with anxiety, depression, substance use disorders, things like that. And beyond that, there could be a lot of potential to benefit many people in society. So another term that's sometimes used is entheogen, or generating the divine within. For some people, psychedelics can have what we would call profound mystical, spiritual, or religious aspects to their experience, or sometimes existential sort of realizations can occur. Some artwork from Alex Gray, a very notable psychedelic artist, that I think kind of gives a sense of the infinite potential that can happen in the psychedelic dosing. So another term that is used in pathogen, the term psychedelic is sometimes kind of, it can mean different things when different people say it. There's kind of the classical psychedelic term, which is a more narrow kind of definition of things like DMT, which is in ayahuasca, psilocybin, which can occur in certain types of mushrooms, LSD, among others. And then there's empathogens, which MDMA is kind of the most well-known pathogen. It has some overlapping effects in terms of the altered state of consciousness and what's happening in the body. But there's often a bit gentler of an experience and a lot of emotional relatedness, connectedness, and love that can also very much happen in psychedelic experience, but not necessarily, and happens pretty commonly with MDMA. That's also been, MDMA at this point seems to be very near, hopefully, knock on wood, FDA approval for the treatment of post-traumatic stress disorder. Hallucinogen is often kind of the more technical term used, although it really is a misnomer, because psychedelics often can cause a lot of perceptual changes and what we would call closed-eyed visuals, but in terms of actually hallucinating, seeing, or hearing things that just aren't there, it can happen, but that's not probably one of the more prominent features of any of the psychedelics, at least not given at the doses that we would typically give them in our studies. There's different sort of, chemical backgrounds. What of interest here, I think, is, phenethylamine is one sort of chemical backbone of some psychedelics, including dopamine, which is a very naturally occurring part of our body, very important part of many parts of our body, but certainly our brain in terms of the neurotransmitters. So phenethylamine and dopamine are closely related. And then tryptamine, which is very closely related to serotonin. So we think that, a lot of these compounds that we're giving are interacting with the body's kind of natural receptors for these natural neurotransmitter chemicals that are used in the brain. So psilocybin is one of the most actively researched of the psychedelic compounds in the modern research. Psilocybin mushrooms, I think, really came to the attention of the so-called Western world because of shamans and certain parts of what we call Mexico now. Indigenous groups clearly seem to have used these for hundreds, if not thousands of years. And they would call it Teonanacatl, or flesh of the gods. I probably didn't say that quite right, but we can see here that there's these, there's hundreds of naturally occurring psilocybin-containing mushrooms that probably many different groups of humans have used over the years. But the groups in Mexico in particular were the ones that seemed to carry on that use for a very long time. So here's just a sense of how these mushrooms kind of can occur basically on most every continent in the world except Antarctica. MDMA we talked about. Sasha Shulgin was a chemist who helped kind of introduce that into therapy. MDMA was used kind of in the underground therapy until the 80s. So it got a little bit further along because it escaped kind of the government attention until the 80s, but certainly seems to have a lot of potential, therapeutic potential for post-traumatic stress disorder and probably a variety of other sorts of problems as well. Ayahuasca is a well-known psychedelic. It would be technically called an admixture, which is brewed from two plants in the Amazon, a root and a leaf, and the two together potentiate the effect. The DMT is thought to be the most kind of psychedelic of the compounds in ayahuasca, and DMT is having some interest in terms of research studies examining it to treat things like depression. LSD, I mentioned one of the studies we're working on, which is the study of LSD to treat generalized anxiety. Albert Hoffman discovered, well, we believe is the first person to have discovered LSD kind of accidentally in the 40s. And LSD is a derivative of ergot, which is a fungus that occurs on kind of rye and barley and other sorts of wheat plants. And, you know, ergot has been used for various medicinal purposes, not as far as we can tell for necessarily altered states of consciousness, but there's a lot of tantalizing theories out there that there may have been ways of kind of using ergot in traditional methods and various kind of European indigenous cultures to promote altered states of consciousness. But it was actually used by midwives. Hoffman was trying to find a way to do clotting for like uterine bleeding, and particularly when uterine bleeding was happening in birth kind of scenarios. And I don't think he had ever developed that, but just kind of accidentally discovered LSD as a result of trying to do some chemistry experiments. Mescaline is another compound that's very present in kind of traditional, the various traditions. There's peyote, which occurs in the southwestern kind of United States and Mexico, which has mescaline. And then there's also Huachuma, or also known as San Pedro, which occurs in the Andes and has mescaline, and those have been used. We know in the case of peyote, there's really pretty direct archaeological evidence for thousands of years of use. Peyote was allowed, the US government did end up allowing in the 90s that the Native American Church and its members would be able to take peyote as part of their religious observance. Ketamine, not technically in the psychedelic kind of chemical compound, but can cause altered states of consciousness that may have some overlap with some of the psychedelics. It's technically in what is known as the aerocyclohexamine family. Ketamine was developed by this chemist, Calvin Stevens, as a dissociative anesthetic. It's many people don't know that PCP was used actually as an anesthetic for a period of time until people realized that the patients would sometimes just go crazy with PCP. So ketamine is actually a chemical relative of PCP, and can still cause people to go somewhat kind of get agitated and things like that, but not to the same level as PCP. So it was kind of a breakthrough at the time. Ketamine also was used a lot in the Vietnam War. It was known as the buddy drug. If somebody got severely injured, soldiers were usually carrying around ketamine and would give each other a big whopping dose to kind of acutely help with the pain and kind of take them, hopefully to a less agitated state of consciousness. If you give a really big dose of ketamine, people really fall into a highly dissociated state, which is colloquially sometimes known as like a K-hole. But ketamine was kind of used mainly as just an anesthetic, and I think people started to become aware of it kind of recreationally in its use. It became a controlled substance in the late 90s. And then in the early 2000s, it started being studied for treatment-resistant depression. Was originally mostly studied just as kind of a chemical agent for depression, but lately people have become more and more aware that it might be also interesting to look at the subjective, kind of psychedelic effects on the mind. So it can be used in sort of a ketamine-assisted psychotherapy model that's very similar to other sorts of psychedelic-assisted psychotherapies. And then there's so many more psychedelics out there, things that cause altered states of consciousness similar to psychedelics. And many of these are being researched or hopefully will be researched for a variety of purposes. So psychedelics is part of mental health research. So we are actively seeking volunteers for our studies. Certainly you can go to the Segal Trials website and reach out to us, or if you have a friend or someone, you're a mental health practitioner and you work with patients, you'll be able to refer them to us. So their involvement here is strictly study related. We want them to generally maintain their contact with their current ongoing providers if they have any. It's not necessary that they do, but some people do. Our volunteers are not charged. In fact, they're often compensated for their time as well as their travel. So it's usually a paid volunteers. We're enrolling for studies in generalized anxiety, as I mentioned, which is the LSD study, as well as some treatment-resistant depression studies that will be starting, one that's already started, psilocybin, and another one for a DMT compound starting soon. And then perhaps some depression and alcohol use disorder studies happening soon. We actually also hope to start a phase 1 study for people that don't currently have a mental health diagnosis or problem of a psychedelic compound. So, I guess the message I would give is that, if you are interested in a study or know someone interested in a study and you're referred and for some reason don't qualify, there's a pretty lengthy list of inclusion and exclusion criteria for each study. So not everyone who applies who we would otherwise think could be a good candidate for the study is actually always accepted into the study. But since we're always having studies end and new studies begin, it's good to keep in touch with us. And we also try and, keep track of people who have contacted us so that we can reach out if a study does come along that it seems like might be a good fit for them. I would say in terms of, the study process, it's important to maybe talk a little bit about how that works so that, if you refer someone or if you call us yourself, what happens? So the first step is what we would call a pre-screen. That's often a phone call, but sometimes an in-person visit where you're usually asked about 15 to 20 minutes of questions about kind of your health, your medical health, your mental health, and a variety of other sort of factors. The pre-screening and screening process is really helped to make sure that, yes, that you are a good fit for the study, but also to ensure that, we feel like it's likely to be pretty safe for you to move forward. It should be noted that a lot of these studies are being conducted to also assess, the safety of these compounds. So there's a very lengthy informed consent process about kind of what we know, what we don't know, so that each of our volunteers can really make, an informed decision about if they want to participate in the study. And of course, participation is always voluntary and people are able to drop out at any point if they feel like it's not a good fit for them. So there's the pre-screening, then there's a screening baseline visits where we're doing very lengthy mental health and medical evaluations of rating scales. And it's really, I think, a very important part of doing this research safely and also, effectively to get the sort of research and the quality of research needed. The FDA has certain standards they really expect in terms of how these studies need to be done to give the quality of evidence that they consider sufficient to prove, if a specific compound is safe and effective for, any given problem that's being studied. And then, is when we kind of get into the preparation phase with the therapist and what we call the treatment phase. The dosing session or sessions happen. A lot of the studies are single dosing, although we do have some that are 2 or even multiple dosing opportunities. So that's more kind of study specific, and of course, will be part of the informed consent process. And then there's the integration follow-up, and usually we follow people for a few months afterwards to just kind of make sure that they're not having any side effects from their treatment and kind of tracking their progress in terms of, if their anxiety or the depression seems to have changed much based on the dosing. Many of our studies have some sort of control, which sometimes is a placebo or an active placebo. That's part of the informed consent process, is informing you like what are the potential dosing options. And, that's something that is really important to know about participating in one of our studies, but it's kind of study specific in terms of, how that is actually playing out. So yeah, I mean, it can be a really great opportunity for people to receive, psychedelic therapy and a psychedelic treatment in a pretty structured and safe and controlled setting where you're getting a lot of support, preparation, and integration, and a lot of support during your dosing session. And it's also a really great opportunity to contribute to mental health research and the science, where many people on this call may be aware that there is somewhat of a mental health crisis, I would say, in this country. And there's a lot of depression, a lot of anxiety, substance use disorders. And so we're hoping that this research could help contribute to finding some potential solutions or aids, allies to people in trying to help treat those sorts of issues. Because, like I said, we have a lot of data, and in my clinical experience as a psychiatrist, we know that our existing treatments seem to work okay for some people, but are failing so many people. If someone does refer a patient to us, we do offer an affiliate program and some incentives sometimes to help with that and aid in that referral process. So if there's ever questions about clinical research studies, and we do encourage reaching out to our center at Siegel Trials. I'm always happy to help answer questions, and a lot of our staff is very knowledgeable and can answer these questions. So we want to make sure that people have all their questions answered heading into a study like this, or if they're wanting to refer someone, be able to have questions also answered. So this is our website, siegeltrials.com /psychedelics. Phone number is 877-734-2588. I'll leave this slide up. So we have a lot of time here for questions. There's also, if we are running low on questions, I also have a lot of other topics I can kind of delve into in terms of some of the science and the neuroscience behind the psychedelics, and also there's a lot of research being done on some of the, what sort of subjective effects may or may not aid in people's healing. But yeah, I'll take a pause now and see if my staff and assistants can help aid in any sort of questions that may have come up.
Yes. So Dr. Fisher, I have a question so with everything that you'd mentioned, in your experience, out of all the psychedelic substance that it's being researched right now, do you have an idea of what maybe what psychedelic substance and for which indication, mental health indication, would be the first to be FDA approved, or more streamlined, or what's winning the race?
Yeah, so I mean, ketamine is already available. So there are some, not a lot of practitioners, but there are some practitioners in the community already practicing kind of psychedelic therapy with ketamine. My opinion is there may be some limitations in the use of ketamine as compared to some of the other, psychedelic things being researched. Ketamine is, there's a variety of clinics, but there is an infusion clinic of South Florida that offers ketamine locally, as well as some other providers. But in terms of the kind of next one that's likely to be approved is there's a nonprofit and group called MAPS that has sponsored research of MDMA, which goes by the street name sometimes of ecstasy or Molly, which what you would get on the street is very often adulterated. But MDMA can be given for post-traumatic stress disorder, and they are the ones that seem most likely to get their approval within maybe a year or two. But you can't really count your chickens before they're hatched. And after that, it could be one of the psilocybin research groups that is next to kind of get an approval.
Very nice. And I see
Yeah,
we
but
have a,
the research process is, really quite lengthy. It's quite expensive. Um, a lot of times, the research process can only be sponsored by companies that have pretty deep pockets, because it can sometimes cost hundreds of millions of dollars to go through the entire FDA drug approval process, which starts with kind of preclinical work, um, and with kind of often in lab work, sometimes some animal testing, and then goes on to phase 1 studies, which are kind of safety studies, a phase 2 study, which is usually several hundred participants who are looking at effectiveness and safety, and then 2 or more phase 3 studies need to be done, which often includes thousands of participants. So it's really quite, that can be a big barrier for some people who want to do this type of research, because the drug approval research process is so expensive. And that is something that's a very frequent topic of discussion now, is how can we do this in a way that's still, protecting people's safety and helping us feel like we're putting actual medicine into, the hands of doctors in the community,
mhm.
but also not making it so prohibitive that maybe good medicines that aren't able to be researched because it's just so expensive, and it's only if companies with deep pockets are able to afford doing it because they see an investment potential.
I see.
Quick question. In terms of how would people ask questions if they have any? Is there a chat or something that?
Yes, if you go to the attendees, you can see that right now that Alicia Hugh has her hand up. So,
Okay, I don't see that.
okay. Oh, she did. Okay. It's no longer up. So I'm going to go ahead and go to Brian Huberty. Oh,
Okay. Yeah, I'm not hearing Brian. He's actually a personal contact of mine, so he just texted me his question. So let's see. The question is, I've applied for a study with Siegel in the last year, but was never contacted specifically for anxiety. Do you need to be clinically diagnosed or on medication for treatment of the disorder to qualify? So in terms of, well, I'm sorry that no one ever contacted you. I'm not sure why that didn't happen. We usually try to be very on the ball with contacting individuals. And I would say in the future, if that ever happens, do feel free to reach out to us again, or reach out to me personally to try to help coordinate, and facilitate, the sort of evaluation process that we need to do. In terms of each study has different inclusion and exclusion criteria. For the anxiety study, you don't have to have been previously clinically diagnosed or have taken any medication to treat the disorder to qualify for that specific study. Some of our other studies, you do have to be previously clinically diagnosed and have had to try medications, but for that study of LSD for generalized anxiety, you don't. So, Brian, in the case that you're still interested in the study, we will definitely have our staff contact you sometime this week. Just message me back and let me know if you'd like to receive that from our staff.
okay, very good. So so I see questions coming in. If and Dr. Fisher, if you can hit the unmute button, for example, with Alicia, and she can ask her question.
See, I'm not so sure the full attendee list is popping up on my end of things. So I don't know if you're able to do that yourself.
Sure. There we go.
Oh wait, maybe I'm missing it. Okay.
So here.
Hello,
yeah,
can you hear me?
Yes, thank you. Whew, there you are.
Hi, Dr. Fisher. I have a question for you. And you did mention, um, you had said something that kind of segued into my question. So my question is, as far as accessibility, once, just by way of example, like MDMA becomes available, I know right now psilocybin is available in Oregon, and the average price point for Oregon for someone to pay for a facilitator, I had last read like $3,500 for one session for 3.5 grams. That's not feasible for a lot of people, and majority of the people that are suffering from mental health or are usually the ones that can't afford it. So my question to you is, it's twofold. What's your personal opinion as far as accessibility, where you like to see it go, and what medicines, psychedelics you see can be used in more, like how they can be more accessible, or what your thoughts are as far as like community engagement or like group? Because I had heard, or I know that there's been conversation about group therapy, and then in order for that to be done, do those models have to undergo clinical trials as well?
Yeah, those are really great questions, and there's a lot we don't know because, first off, group, sort of medication therapy. I think in most any area of medicine, including psychedelic and psychiatric medicine, hasn't really been done before, but there's certainly a strong rationale for wanting to use that. So there is starting to be some research done. I do think accessibility is a big sort of question. In Oregon, I think one of the problems is that since it's not really an approved medical treatment, your health insurance, won't cover it. And so certainly the hope and expectation is that once these, and if and when, these become approved FDA treatments, then third-party payers, Medicare, Medicaid, insurances generally have to provide some level of coverage. Of course, that would still leave uninsured people with difficulty accessing these treatments, which unfortunately is the case for a lot of their medical care. And it's more, I think, a symptom of a gap in our country's allowing, equal and full access to our entire society to get medical treatment. But that maybe is a little bit beyond the scope of the discussion right now. But I think that certainly making it an approved medical treatment, I think, should make it, more affordable for many people who otherwise couldn't afford the other kind of points or routes of access to the treatments. And group therapy certainly seems to be a potentially amenable way to doing this as well. I think the other hope is, we don't know if this will be the case or not, is that there are a variety of nonprofits helping to do these clinical studies or directly sponsoring the clinical studies. And the hope would be that maybe they have less sort of maximizing the profit motive that, traditional pharmaceutical for-profit company might do, and that might help moderate the cost, but we really don't know. It is still likely to seem to have a high sticker shock. The hope is that the third-party payers are going to be covering that in the majority of cases. But I do think that there will definitely be routes forward to exploring the group therapy and making that available post-approval. That research is currently being done both by in sort of clinical studies, and also there are kind of economists and other groups of people studying ways to decrease costs, including group therapy, which can not only decrease the cost but also increase the accessibility, because kind of if you're having two therapists per one patient, that's you're going to run out of therapist time really quick. There's already a big shortage of mental health providers in our country, and certain geographical locations that shortage is quite dire. So if you're able to kind of now have one or two therapists, kind of accounting for, many more patients at the same time, and that will also increase the accessibility and somewhat decrease the cost.
Very nice. So we did receive a question from Melissa, and she's asking, are there any contraindications that potential patients should be aware of?
Yeah, that's a really great question, and I would say that there are. So each study I mentioned has like inclusion criteria, which means for instance, you have to have at least a moderate level of anxiety, moderate to severe level of anxiety, to qualify for our anxiety study. If after speaking with a potential participant in our study, they're really endorsing low or mild levels of anxiety, then that they may not meet that inclusion criteria. There's also even lengthier lists of exclusion criteria, which means, you know, that could be sort of analogous to a contraindication, or could also just sometimes be for the sake of the study and the data's integrity, that, you know, they think that, for instance, you know, if someone is, you know, taking marijuana on a regular basis, it may not technically be like a drug-drug interaction contraindication, but they don't want somebody who's, you know, too regularly taking marijuana to be in the study because they're not so sure if that's the sort of clinical population that they're trying to target. So in general, you know, the contraindications can be very severe medical problems or illnesses. It can sometimes be an exclusionary criteria for a lot of our studies. People, if they have a personal or really close family relative that's had a history of psychosis, schizophrenia, bipolar disorder, they may not always qualify for a study. We're not so sure if it's safe to give to people with, and how that could work to give it to people with personal or, you know, close family histories, because there's a lot of kind of anecdotal evidence out there that people with, you know, those sorts of histories may not react so well to the treatment. Yeah, so there's each study has its own specific list and long list. A lot of the studies do also say if you've had a lot of previous psychedelic use yourself, they may not include you in the study. So those lists actually aren't really set by us at Siegel. Those are often set by the groups that are sponsoring these studies.
Very nice. So let me see what we have here. Alicia, do you have another question? Your hand's up. Okay, I don't think.
I do not. Sorry.
Okay, no worries. Just wanted to double check to make sure. Okay. Anybody else have any questions? Okay. All right, Dr. Fisher, I think you've answered everyone. That's
Perfect. All right. Well, I want to thank everyone for attending, for your great questions. Certainly would encourage you to reach out to us at Siegel. You know, I'm happy to, if you ask, you know, to leave me a message. I'm always happy to speak to people directly if they have questions about the study. And we also have very highly trained staff able to answer a lot of the questions. So yeah, thanks so much for attending, and you know, we'll probably do some more of these webinars in the future. So keep an eye out for those. And yeah, thanks again. Hope everyone has a great night.
Thank you very much.
Thank you.